Hi, my name is Iqbal Malik. I'm an interventional cardiologist at One Welbeck Heart Health and Imperial College Healthcare NHS Trust, and we're talking today about PFO closure in stroke. So Hailey Bieber, as you know, has recently had a stroke in March and then had a PFO closure recommended to try and close things up and reduce the risk of stroke. At 25, how do you manage to end up having a stroke? Well, it's rare. That's good news for all you 25-year-olds. I would class anyone young having a stroke being under 55. That happens to be my age in 2022. And over that age, then one will be classed as slightly older with perhaps a different set of risk factors. But age is a number. There's no doubt that 25 is young. Even some 60-year-olds, 65-year-olds will have no other risk factors except for this PFO. It's a flap in the heart which you're born with. In 3/4 of people it seals immediately at birth, and in 1/4 of people it remains open. So do you need now to hunt out to see whether you have a PFO? No, you don't. It'll just create health anxiety. There's no reason to worry about it. However, if you have a major health condition such as a stroke at a young age, just as Hailey has had, then you should be investigated fully. And once we've ruled out other things such as irregular heartbeats, sticky blood, clotting disorders, brain tumours, then if the only thing we can find is a PFO, the evidence is very strong that we should close it. So how do we diagnose it? We diagnose it with a bubble contrast echocardiogram usually, where we inject some bubbles into your veins. They go to the right side of the heart and they should not appear in the left side of the heart. And if they do, then you have a PFO. And if you've had a stroke, then we would consider closing it. Well, we close a PFO via a needle puncture in the groin, taking a wire across the PFO flap, getting a small plastic pipe on the wire through the PFO flap, and then placing what is in fact a double umbrella device to close the PFO down. In effect, putting a cuff link in to stop the cuff opening up. And once we've done that, then hopefully the transit of any clot from the right side of the heart to the left side of the heart is reduced. It's usually a day case procedure. I normally do it under general anesthetic, so I have the imaging from my transesophageal echo and the imaging from the x-ray machine to place the device in exactly the right place. And I can usually do it within 20 minutes. It really is quite a quick procedure. You go home the same day. On the NHS side, I do it at the Hammersmith Hospital and also at the Royal Brompton Hospital, where I also work. And on the private side, most of my PFO closures are now done at One Welbeck Heart Health, which is one of our cardiac facilities in London. So, in summary, do you need to be concerned that you have a PFO? No, unless you've actually had a stroke already, in which case, if you're young, you should be checked out for it. If you have a PFO, what's going to happen? Well, we'll take you through one of our multidisciplinary meetings and decide whether we want to close the hole or not. And if we do, as I say, it's a straightforward procedure.